This is WISN 12 News with breaking news.
And we are breaking into regular programming because we want to make sure you hear from the governor as he talks about coronavirus. Let's listen in here, Governor Tony Evers.
The first 2 deaths in Wisconsin related to COVID-19. And by the time we woke up this morning, there had been a 3rd confirmed death. Unfortunately, this number is expected to rise and things will get worse before they get better. Our hearts go out to the families and communities mourning these loved ones. This is a difficult time for those who suffer with this illness and those that face fear, uncertainty, and hardship due to the impact this virus is having on our economy. The fight against COVID-19 will not be easy, but my administration and the Wisconsin Department of Health Services are working tirelessly to protect the health and safety of the state of Wisconsin. I want to recognize the hard work and courage of those caring for the patients with COVID-19 and all those on the front line in the fight against this outbreak. And I want to say again and deliver this simple message: stay at home. There are folks working around the clock to keep us all safe. Our healthcare workers, our first responders, farmers, manufacturers, grocery store employees, and they can't stay at home. We need these folks to stay healthy so that they can continue to serve our communities. So please only leave your home if it's absolutely necessary. In addition to encouraging you to stay home, I'd also like to take the opportunity to update you on some of the ways the state is working to respond to COVID-19 and help those who are impacted. First, I will again remind folks that we have an important election coming up. We'll continue to closely watch the situation, do everything possible to make sure that we have fair, safe elections. As I've said before, people should vote absentee. This is the best and safest way to vote. The state is working with the Wisconsin Election Commission to help ensure our local clerks have what they need. But folks, I want to encourage you to request your absentee ballots now. Do not wait until the deadline of April 2nd. Visit myvotewisconsin.gov to request your ballot. That's myvote.wisconsin.gov to request your ballot. Requesting an absentee ballot isn't the only government service you can complete online. State agencies have taken a number of steps to make online services more available and accessible so that our workers and the public can remain safe. An example is the Department of Workforce Development, which is working diligently to process an unprecedented amount of claims so that the much-needed economic assistance makes it into the hands of Wisconsin families. I encourage individuals who are out of work due to COVID-19 to visit dwd.wisconsin.gov and file their unemployment insurance claim online. Roughly 90% of the individuals are able to start and complete their claim online without the need to speak to a claims specialist over the phone, and you can avoid waits. The DMV, to minimize in-person visits to DMVs, driver's licenses and commercial driver's licenses that expire during this public health emergency will be automatically extended for 60 days. Late fees will be waived, and all vehicle-related transactions can be done online. Wisconsin Economic Development Corporation is leading a webinar on small business strategies to cope with COVID-19 and has released a brochure of some of the best practices to follow. We are also working with the federal government to unlock this disaster assistance loans. State government is also working to support essential sectors of our emerging response. The Department of Children and Families is working with health care providers and workers in critical fields to find child care and is developing a plan for on-site child care that can be used by hospitals across the state based on a model that Epic Systems and UW Health have used. Additionally, DCF is continuing plans for group homes, residential care centers, and other shelter-like environments to maintain service. The Department of Agriculture, Trade, and Consumer Protection is focused on keeping food on Wisconsin shelves and supporting the industries we serve. Through regular communication with our agriculture partners, we hear farmers loud and clear, and we're working to ensure that the safety and stability of the state's food supply is maintained. We're also helping consumers protect themselves from price gouging, fraud, and scams during this clearly confusing time. The Department of Safety and Professional Services is working with state boards, the administration, and legislatures to take the actions necessary to maximize the available health care workforce. This includes advocating for rules suspensions, legislative changes, as well as prioritizing review of license applications for those health care professions. And the dedicated staff of the Wisconsin Department of Veterans Affairs is working hard to help ensure that veterans and others who live and work at our state veterans' homes are kept healthy and safe. The individuals who live at these homes are among those at the highest risk, and we are very appreciative of the work that healthcare personnel and others who work at these skilled nursing facilities for all they're doing. Over the last several days, I've been in contact with hundreds of workers, small business owners, manufacturers, locally elected officials, first responders, and members of our healthcare workforce. And what I've heard from them is that they are ready to stand up and help. The State Emergency Operations Center remains at a level 1 response in support of my office and the Department of Health Services. Staff from the Wisconsin Emergency Management are working alongside other state agencies, along with nonprofit organizations and the private sector, to address critical needs being reported by county and tribal governments across the state. Small example, the Red Cross is assisting DHS in planning operations as well as identifying volunteer manpower resources. And I'll remind folks again, if you're able to donate blood, please do so. We're coming up with a critical need in that area. And helping to support us all is the Wisconsin National Guard. Under the leadership of Major General Paul Knapp, the Adjutant General of the Wisconsin National Guard, our 10,000 soldiers and airmen from across the state are ready to serve by assisting state agencies with logistics and planning, specimen collection, providing a source of medical professionals, and more. Members of the National Guards are friends and neighbors here in Wisconsin, and they have once again answered the call to serve our communities and help keep us safe. Together we can make a difference. I urge you to stay home if you can, and especially if you're sick. Wash your hands frequently and thoroughly, and practice social distancing. These recommendations are vital for keeping our healthcare workers safe and helping to stop the spread of COVID-19. So thank you so much, and now I will turn it over to DHS Secretary Designee Andrea Palm. Andrea.
Thank you, Governor, and thanks to all of you for joining us again today. First, I want to join the Governor in offering our deepest sympathies to the families of the patients who passed away. Our hearts go out to them and to the people suffering from this virus. This has been hard, and I'm sorry to say that we do expect the situation to worsen. We know from what we've seen in other states and other countries that COVID-19 will affect thousands of Wisconsinites. Most of these illnesses will be mild, but for others, including our most vulnerable, outcomes will be more severe. Sadly, these deaths won't be our only deaths. We will see more. We need to start preparing for that, and for the reality that this is going to be a very hard time for Wisconsinites. There are things we can do. We can protect our neighbors and our friends who are vulnerable and those who work in the healthcare system by staying home. This means people should not travel unnecessarily. We should each cancel all of our non-essential appointments. We can prepare for the increased need for our healthcare system, and we can come together to support each other through this pandemic. Please call your friends and family, check on them, talk through it, support each other. So here's where we stand today. There are 3,455 negative tests, and we now have 206 positive cases in the state of Wisconsin. As the governor said, we have updated our restrictions on mass gatherings of 10 or more people to avoid further spread of COVID-19. Let me take just a moment to be clear about what we mean by social distancing. Please keep 6 feet between people and avoid direct physical contact. We know these increased restrictions impact your lives and the day-to-day business of places like hair salons, tattoo parlors, and other services that require close contact, but it's necessary to take these steps. It is also imperative that we continue to remain vigilant with our health hygiene practices. Please wash your hands frequently with soap and water, cover your coughs and sneezes, and stay home as much as possible, but especially if you are sick. While most cases of COVID-19 have been among people older than 50, younger people, particularly those between 18 and 30 years of age, aren't immune to COVID-19. Anyone can contract the virus, and it's as important for young and healthy people to heed the orders requiring social distancing as it is for the rest of us. Please take this guidance seriously for your health and the health of those around you. This is critical to our collective ability to flatten the curve and protect the capacity of the healthcare system to serve those who will suffer with the most severe disease from COVID-19. I want to personally acknowledge the tremendous efforts of the healthcare community throughout this public health emergency so far. We will continue to need them on the front lines, and so all of the efforts of those of us around the state are critical to helping them do their jobs. Yesterday, we notified healthcare providers that the supply of personal protective equipment, such as masks, that we are going to receive here in Wisconsin from the Federal Strategic National Stockpile won't be enough to meet the needs of our healthcare facilities at surge capacity. This is obviously very concerning to us, and the governor and I continue to look for ways to mitigate the shortages and protect those who are on the front lines taking care of sick people. We are working to increase access to telehealth in our Medicaid and Badger Care programs, and other partners are also working to increase telehealth options for all Wisconsinites, again in an effort to protect our healthcare workers from potential exposure. Where possible, please use telehealth for your healthcare appointments. This will protect healthcare providers, yourself, and others. Again, I want to thank the people of Wisconsin for their adaptability during this public health emergency. Many of you are now working at home while your children prepare for learning outside of the classroom. You've kept up your visits with family members in nursing homes and assisted living facilities with phone calls and FaceTime. You've canceled appointments and long planned for trips, and some of you we know are struggling with the uncertainty of whether or not you will have a job or a business when all this is said and done. We will continue to ask more of you in the days and weeks ahead. Yet we continue to be amazed at the way you have taken this pandemic seriously and risen to the challenge. We can't thank you enough for the sacrifices you're making for the health and safety of the people of Wisconsin.
Thank you, and we'll now open it to questions. A reminder to maintain the audio quality. Keep your phones on mute until it's time to ask your question, and we'll take questions in the order of the RSVPs. One question and one follow-up, please. And we'll begin the questions with Molly Beck from the Milwaukee Journal-Sentinel. Molly? And a reminder, *6 to mute and unmute your phones. We'll move on then to Patrick Marley from the Milwaukee Journal-Sentinel. Okay, we'll move on then to Tim Vetcher from TMJ4 in Milwaukee. Tim?
Hi. Hi there. This is Patrick. I'm sorry.
Okay, Patrick.
Yeah, thanks for taking the call here. Could you, California and Illinois have issued shelter-in-place orders. You're encouraging people to stay at home. At what point might we see that order specifically people must stay in their homes from the government?
Well, I believe that we'll be able to avoid that. People in the state of Wisconsin are taking this seriously. We continue to encourage them to stay at home. But I know other states are doing that. We will follow the science on that, and we don't anticipate doing that. We do believe that people are going to be moderating their behavior and will continue to do that.
We've been listening into Governor Evers and other state health officials there. We will continue to monitor this question and answer period